So where is origin and insertion of Sartorius?
It inserts in the pezanserine, or originates. No, it inserts.
Inserts on pezanserine. Where is it origin?
ASIS.
ASIS, right? So we go ASIS, and then as we find it, where is it going to run? So ASIS. So if we find ASIS, okay, and then pezanserine, okay, how does it run here?
Heel.
Kind of comes
Like
like this, right? Okay, so knowing where it runs here and then down and around. Okay, so we're just going to kind of put her in this position to help us a little bit. All right, so we find ASIS, we can probably find it right there. So if I'm right on ASIS and I just have her push into here, okay, I have her flex her hip, which gets it. Okay, what else can I have her do? What other muscles, what other motions does it do? Abduct, right? So I can have you push down into the, okay, good, and I can feel it right there contract too. You can feel it tighten up, okay? What else does it do?
Flex, externally rotate.
Okay. Flexes the knee too, right? So try to bend the knee. Okay, and I can still feel it there. So if I have her bend her knee and I feel something right here on the front of the hip, it's gotta be Sartorius, right? If I have her do hip flexion, push into me, and I feel something, what else could it be? What else is right in here that flexes the hip?
Rec fem.
Rec fem, right? So if I'm not directly on ASIS, maybe I'm here and I find AIIS and I have her do it. That could be more rec fem. Okay? So if I do knee flexion, then I go ahead and flex the knee, and I feel that muscle contract right there. It's got to be Sartorius.
Yeah, I can feel it.
You can feel me flick right over. Okay. So then you can try to. So if I have her go ahead and bend the knee, okay, I can try to find it and trace it out. Okay. What am I eventually going to get to that also flexes the knee? There's an adductor muscle that comes down here. It's the only adductor muscle that crosses the knee joint. Gracilis. Okay, eventually I'm going to get into gracilis too, which is going to flex the knee joint. It's the other muscle that comes into that pezanserine. Okay, so try to find ASIS and then find it at the origin, and then just try to trace it down and just check the different motions: abduction, flexion, knee flexion, external rotation. Whatever you want to do. How would she externally rotate in this position? What would external rotation be?
Pushing down.
Wouldn't that be like the abduction then?
It'd be like abduction, yeah. What else could I do? How could I get her to abduct? It would be a cue towards her foot.
Lift her
If
foot
I have
up
her
towards
lift
the
her
ceiling?
foot up to the ceiling, that would also, if this stays here, it would also be external rotation. If she does this, that would be a deduction, okay? But if she just lifts that up and this stays here, that would be, so what's happening is this is happening at her hip, okay? But she's doing it by here, okay? So you can mess with any of those motions and try to trace out that Sartorius, okay? Let's go, you can take that down for me. And let's go, you just want to do iliacus and psoas?
Sure.
While I'm here? Okay. So, I personally, so I got to go in through the belly, is that okay with you? Okay. So I personally like the hips up a little bit more that way. So that's going to put that psoas a little bit more on slack. Okay, so where's our origin of our psoas?
Transverse process of the
Perfect. Transverse process of vertebral bodies of the lumbar vertebrae. Okay. And then where does it insert onto?
iliac fossa.
So the iliacus is on the iliac fossa, okay, and those two muscles will come together to do become the conjoint tendon to the lesser trochanter of the hip, okay, which is going to be right here. Okay, remember they come down. So here's all this red is psoas. This is iliacus. They're going to come across and then they kind of hook down into that lesser trochanter. Okay, but we're going to palpate them up here. Okay. So, iliacus is going to be very easy because we can just find that ASIS and that iliac crest, okay, and then all we're going to do is just try to hook our fingers into that, just like we did with our iliac fossa 2 weeks ago. We get here and then we kind of hook into it, and then with this hand it's really easy. I can just put it here and just say try to lift your knee up, okay, and relax. So that's going to get iliacus, okay. Psoas is going to be a little harder. The easiest way to kind of start to find it is find ASIS, okay, find the belly button, and somewhere right in between that is going to be where our psoas is, okay? So this is one where you have to explain to them, and a lot of times I get out my textbook and I tell my patients, look, this is the muscle I need to palpate. It attaches onto the front of your spine. The only way I can get there is going through your abdomen. Are you okay with that? Okay, and I've never had somebody say no. So are you okay with that?
Yes.
Good. Okay, so approximately we go ASIS to belly button, somewhere right in the middle there is where we need to go. Okay, now you have all your abdominal contents in there. Okay, so you just kind of need to work down slowly till you'll get there. And again, this is tender on a lot of people. And people who are really ticklish, good luck.
Yep, I can't do that.
Okay, so as I kind of sink in there, as she relaxes and breathes, I can get down into that. Okay, now what am I going to do to confirm that I'm on it? What motion? I could have her do trunk flexion, but what's going to happen if I have her do trunk flexion?
Gonna push your hand.
What's going to push me out though?
On
The rectus is probably going to push me out, so I can just resist that hip flexion again. Yeah, good, and relax. So you feel that right underneath my finger. Go ahead and push it. Good, right when she contracts, I feel it right underneath the pads of my finger. Okay. What do we need to be careful with if we're on the left side?
the left.
Hmm?
Left side.
The left side. What's different about the left side of our body than our right in that area?
Spleen over
Your spleen's over there, but that's up here. That's
Yeah, I
underneath
was
your
gonna
rib
say it's
cage.
up here.
Unless you have mono, then it drops down.
there. No, I don't.
That's why you can't play contact. So you know that's why you can't play contact sports when you have mono, right? Because your spleen enlarges and now it drops below your rib cage. Normally it's above your rib cage where it's protected. When you get mono, your spleen gets bigger, drops below your rib cage, and then you become at risk of injuring it. That's why you can't play sports when you have mono. It was a professional football player that did play when Cowboys ended up rupturing his spleen, I think. He got hit there. So what do you have to be careful? So what if I'm over here? I'd be on the other side there. And what if I decide I come a little bit too medial? Yeah. Your abdominal aorta, your aorta's right there.
Oh.
Okay.
Oh, I
So
can
if I'm
feel
right
it.
here, so you can feel it. So I can feel her pulse now. So I'm probably too far medial. I need to go a little bit more lateral. But you'll be able to feel it, and I can feel her aorta right there pulsing. So if you feel a pulse and you're on the left side, okay, just move a little bit more lateral. Okay.